Hello, and welcome to Nurses Notes 101. Today, we're going to be talking about cardiac trauma. Cardiac trauma is also known as a cardiac blunt injury, and it's caused by an extreme blunt force, usually with a head on impact. Most of the times, cardiac traumas are also associated with sternal fractures. There can be new arrhythmias for the patient, a decrease in cardiac output, and chest wall injury. Signs and symptoms of cardiac trauma include pain at the breastbone and the ribs. There can be an abnormal chest wall due to flailed chest from a multitude of rib fractures. The patient can show symptoms of heart failure due to an inadequate cardiac output from the traumatic event. These symptoms would include shortness of breath, edema, orthopnea, and in severe cases, the patient can also show symptoms of shock, which include hypotension and a fast heart rate. Treatments of cardiac trauma. I have a few listed here. So, most importantly, the patient's going to be in a lot of pain. So, analgesia. If they're not bleeding, we can give an NSAID like Motrin. A lot of times, physicians can steer away from that just because of the risk of bleeding and the effect it can have on the kidneys. What I've seen most frequently is physicians will order epidurals for the patient just to give them kind of continuous pain relief. We can also provide them with narcotics such as morphine, dilaudid, fentanyl. The patient can be put on a PCA pump with dilaudid, let's say, so they can get a set amount every couple of minutes with a lockout dose. And frequently, I've seen these patients provided with lidocaine patches at the site just to provide localized anesthetic. If the rib fractures are bad enough in these patients, they could undergo surgical fixation or rib plating. This isn't something I've commonly seen, but if they have very bad flail chest and they're at risk of puncturing a lung or causing further damage, they will go ahead and do rib plating. Chest physiotherapy is very important in these patients. They're very prone to getting pneumonia and developing atelectasis. So, aggressive pulmonary toileting is important using the Inceptus barometer, and cupping and clapping and chest physiotherapy on the bed is very important for them, just to kind of increase that coughing reflex and get any extra gunk out of their lungs. Respiratory care for them includes brushing their teeth. If they can themselves, that's great. If they can't, uh, a lot of times hospitals have chlorhexidine sponges, and this is good to prevent pneumonia and things like that. Just because they're in pain, they're not going to be coughing as much as they usually do, and their lung capacity is going to be a little bit stunted. So anything to prevent pneumonia is helpful. And also, when these patients are eating, you want to make sure the head of the bed is greater than 30 degrees. Mobilization and early mobilization also really helps these patients. It promotes GI motility, so it'll help them have a bowel movement. It'll prevent pneumonia and prevent atelectasis for them as well. Thank you for listening to Nurses Notes 101. This is my presentation on cardiac trauma. Please let me know if you liked it, like and subscribe.